Hello, and welcome to another live broadcast with MedStar Health. My name is Karen Zingle, and I'm joined today by Baltimore Orioles team physician and sports medicine surgeon, Dr. Christoper Looze. Baltimore Orioles baseball season is in full swing, so we thought today we would talk about sports injuries. If you have any questions, please include them in the comments below, and we'll be sure to ask them to Dr. Looze during the broadcast. Dr. Looze, thank you so much for joining us today.
Yeah, thanks for having me.
Of course. So before we get started with some questions, will you tell our viewers a little bit about yourself?
Yeah, so I'm an orthopedic surgeon here at MedStar. I specialize in sports medicine. To give you a little bit of background, I was an athlete growing up, and really my first dream was to play professional baseball, not necessarily be a doctor. So a little bit different than the normal story, but I had the opportunity to play professional baseball for a little bit and attain that dream. And so once I was done with that after a couple of years of playing professional ball, I had a chance to sort of reflect back and think about the things and the people that kind of helped me along the way. And first off, it's always your parents and then your coaches. But also I had had 2 shoulder surgeries, and I sort of started to think about it. And you realize that those orthopedic surgeons were the ones that kind of kept you on the field chasing that dream. So really when it came down to it, it was really a no-brainer for me to kind of go into sports medicine and do the things that I'm doing now.
Wonderful.
Yeah.
Thank you. All right, so let's get into some questions for you. Let's first talk about sports medicine. Is sports medicine only for athletes?
No, sports medicine really is a subsection of orthopedics where we really like to focus on getting people back to activity. Historically, orthopedics has really been driven towards trauma work and joint replacement work, where we're trying to get people back to their sort of activities of daily living. Sports medicine really focuses on going beyond that, and so what we like to do is focus on getting people back to the higher level activity that they like to do and getting them back to the things that they love. And really that's true from top to bottom, whether that's weekend warriors, you're playing golf on the weekends, you're playing recreational basketball, whether it's kids getting back to youth sports or adults trying to get back to professional or higher level activities, all the way back just to people that recreationally work out. So really there's a piece of it for everyone, and really it's just sort of a slant that we take to really focus on getting you back to the things that you enjoy doing and love.
Great, thank you. That was really helpful. So let's talk about some of the conditions that someone could get and what you treat. Can you talk about that a little bit?
Yeah, absolutely. So joint-wise, I specifically focus on shoulder, elbow, and knee for the most part. But we see all types of sports injuries that pretty much cover the entire body. Being with the Baltimore Orioles and having the history of baseball as a background, I have a particular interest in shoulder and elbow injuries, and in particular Tommy John surgery and UCL reconstructions, which is a common elbow injury or elbow procedure that baseball players need. Yeah. But again, I focus on those joints, but we'll see pretty much any athlete that needs to be seen. So.
Okay, great. So what are some warning signs for conditions that someone could get, and when does a patient know it's time to seek help from you?
Yeah, so I tend to put these things into 2 different buckets. So there's the athlete that has the acute injury where something happens on the field, you twist your knee, something happens where you need acute attention. It's basically right then and there. And in those particular circumstances, pain that doesn't allow you to ambulate or to walk, pain that doesn't allow function or you to return to play, and then swelling is kind of a big thing. Usually significant injuries come along with a significant amount of swelling. So anyone that has an acute injury that can't get back to play and has swelling, difficulty walking, usually that requires further workup, and someone should take a look at it. The other area is chronic overuse type injuries, so things that have sort of been brewing for a period of time, progressively getting worse. Not necessarily an acute injury, but something that's bothering a player or a person and isn't allowing them to do things that they want to do. In that scenario, usually it's pain that doesn't respond to simple non-operative treatment. So you've tried scaling back your activities and you're still having pain that's worsening over the course of time, or just in general, if you have any concerns or there's anything that that is worrisome to you, we're happy to kind of take a look at you and evaluate.
Great, that's some great tips. Thanks. So what are some things that athletes of all ages can do to prevent injuries and stay healthy?
Yeah, that's sort of a big topic in sports these days. The big thing is recovery. and that's been a focus of a lot of current research and thought process in terms of what we do for these athletes. And the key is to prevent overuse injuries. You really got to let your body recover. So adequate time in between outings or sessions of what you're doing, not trying to overdo it too quickly, so gradual progressive increase. And then just allowing your body to have the appropriate conditions to try and recuperate. And then secondly, I think it's really important that people, if they have the opportunity, really get on, if you're going to work out or you're going to be involved in sports, that you get on a good program that focuses on, core strengthening, flexibility, pliability, and things like that. So, you allow your body to recuperate, but you also work in ways that allow your body to function in a better way.
Mm-hmm. Okay, great, thank you. So what else should people know about sports medicine?
I think we've covered a lot of it, but in general, it's again, it's not just for the athletes. It's not just for those that want to be professional athletes. There's a little bit of something in it for everyone, and really, what we're focused on is trying to get people back to the things that they love and do. So.
Great, that's super helpful. Well, thank you so much for providing that insight to our viewers today. That's all the time we have. If you have any other questions, please include them in the comments below. We'll be sure to get them to Dr. Looze and get them answered for you. If you would like to learn more about MedStar Orthopaedic Institute or would like to make an appointment with Dr. Looze, visit medstarortho.org/looze, and that's LOOZE. And the link will also be included in our post. Thank you very much for joining us, and thank you.
Thanks for having me.
Of course.